Hey everyone, this is Dr. Medicine RX, and in today's video we'll be discussing about scurvy. So scurvy is a nutritional disorder occurring due to vitamin C deficiency, and vitamin C, it is a water soluble vitamin, also called as ascorbic acid. Now coming to sources of vitamin C, the main sources are fresh fruits such as citrus, berries and green leafy vegetables. Amla, also known as Indian gooseberry, is the richest source of vitamin C. And vitamin C, it cannot be synthesized in the body. Coming to functions, it is a very effective antioxidant and it plays a major role in collagen biosynthesis. So vitamin C for collagen. So it acts as a cofactor in collagen biosynthesis, where it takes part in the hydroxylation reactions of proline and lysine, and which are required for the formation of mature collagen. It is also a cofactor in the absorption of iron, dietary iron, in the metabolism of folate, and in carnitine and catecholamine metabolism. Coming to etiology, decreased intake, increased requirement and increased losses are the main etiological factors. So decreased intake can be seen in alcoholics or people with eating disorders, or in elderly, people with inflammatory bowel disease or gastroesophageal reflux disease, and those patients who are on parenteral nutrition. And increased requirement is seen in cases of pregnancies or in cases of smoking as well. And in medications, patients who are on medications such as oral contraceptive pills, tetracyclines and aspirin. And there can also be increased loss of vitamin C in cases with diarrhea. And in also patients with renal failure or metastatic renal cell carcinoma who are on various chemotherapeutic treatment therapies. And also in patients with liver transplantation, they are at higher risk for attaining vitamin C deficiency. Coming to pathophysiology, so vitamin C, it is absorbed through small intestine, and then it enters the plasma, and from plasma it is transported across the skin layers via the vitamin C transporters SpCT1 and SpCT2. They are present in epidermis, whereas SpCT2 is present in most of the tissues. So these are sodium dependent vitamin C transporters. Now, as a result of vitamin C deficiency, there is decreased formation of mature collagen, and this mature collagen, it forms structure of various tissues of the body such as the blood vessels, the bones, the skin and mucous membranes. And because of this deficiency, there is a loss of this stable structure. Coming to clinical features, so these features, they present 1 to 3 months after vitamin C deficient diet, and initially they present with lethargy, malaise, fatigue, weight loss, arthralgias and diarrhea. Coming to the cutaneous features, so phrenoderma, which is classically seen with vitamin E deficiency but also occurs with vitamin C, vitamin E and essential fatty acid deficiency. So phrenoderma is seen with follicular hyperkeratosis and with keratotic plugs, and it occurs on various areas of the body such as the anterior aspects of forearms, the abdomen or even the posterior aspects of thighs, and corkscrew hairs. Because of the loss of disulfide bonds, the corkscrew hair, they appear to be corkscrew like, and perifollicular hemorrhages because of the loss of the vessel wall stability, there can also be easy bruising and easy hemorrhages. And woody edema and discoloration of lower extremities is seen as a result of vascular congestion. Coming to oral features, spongy gingivae with the bleeding and erosions, petechiae and ecchymosis can be seen. And in severe cases, hemorrhagic gingivitis, which later becomes purple, necrotic and prone to infection, can also occur. Coming to vascular manifestations, so hemorrhages, subconjunctival, subcutaneous, subperiosteal, intramuscular, intracerebral, intraarticular and even subungual splinter hemorrhages occur. And epistaxis, hematemesis, bloody diarrhea can also be seen. Coming to other manifestations, as a result of extravasation of blood, skin releases proteases leading to paniculitis, that is inflammation of the subcutaneous fat. And in children, even musculoskeletal disease can occur because there is reduced osteoblastic activity, and therefore there is reduced bone matrix formation, and also there is increased bone resorption, which can also cause pain, leading to weakness and pseudoparalysis of legs. And also there is impaired wound healing. Coming to investigations, so the Rumpel lead capillary fragility test is positive. bleeding time, clotting time and prothrombin time are all normal because there is no defect in the platelets or in the clotting factors, but rather it is a defect in the vessel wall itself. And the serum vitamin C levels are less than 0.1 mg per deciliter, whereas the leukocyte vitamin C assay is less than 7 milligrams per dl. And radiograph, it shows various signs such as the Wimberger ring sign, which is nothing but a ring of increased density at epiphysis. Then there's white line of Frankel, which is the widening of the zone of calcification. Then there's something called a Strummerfield zone, which is transverse radiolucent zone at metaphysis, and Pelkin spurs, which are metaphyseal spurs with marginal fractures. Coming to treatment, the recommended dietary allowance for adults is 200 milligrams per day, and for children is 25 milligrams per day. And for the sake of prevention of vitamin C deficiency, we can do supplementation of about 60 milligrams per day of vitamin C. But for therapeutic purposes, 300 to 1000 milligrams per day orally should be given, and a protein-rich diet should also be suggested. And following this treatment, the response is very rapid and complete recovery is seen in 3 months. Thank you. Subscribe for more.